Okay, and welcome to this Zoom PowerPoint presentation on one pill, one gulp. That is, we'll go through 6 cases, mainly pediatrics, of children that have taken 1 or 2 tablets or a gulp of something which has been life-threatening. So we'll do this via a PowerPoint presentation that's got some embedded videos in it, and I hope you enjoy it. So let me just share this for you. We'll get the scary music to start. This is a 2-year-old that drank some orange juice. He then took a nap afterwards and was found by the parents to be cold, limp, and not breathing at all. The ambulance was called. They gave some naloxone intravenously, 100 micrograms, but didn't make any response. The child was intubated, but didn't require any sedation for the intubation. And tragically, that child died of multi-organ failure 7 days later. So what was it? Well, it's the most common cause of accidental pediatric deaths from ingestions in Australia and the United States. It is narcotic and it is methadone. So in this case, the juice that had the methadone was there for a parent and it was taken by the child. Looking at this, I trawled the world of YouTube and found a very similar case that was reported on the US news. And I thought this was sort of a similar thing, and it shows the tragedy of what happens with methadone overdoses.
A 2-year-old Baltimore girl has died after drinking methadone, which is a treatment for heroin addiction. Alvin Thompson and Sinead McNair are charged in their daughter's death. On August 13th, Corey Thompson was taken to a hospital unconscious, unresponsive. Doctors managed to save her, but then she died 11 days later. Police say her parents waited at least 10 hours before taking her to the hospital.
So a very similar story. They waited 10 hours before taking her to the hospital and the child died. In that previous case we're talking about, the child was given naloxone to make a difference. Well, I suppose if you're that far down the track, you're not going to reverse someone who's basically cerebrally dead. So methadone is responsible for over half of accidental drug poisoning deaths in toddlers. And that's from 2016 from B&J Online. Okay. The signs of methadone overdose, well, it's a narcotic overdose signs. You can go from the top, decreased level of consciousness, meiosis, respiratory depression, you know all these ones. You get hypotension, bradycardia, and hypothermia. ECG, you can get QT prolongation, and with tramadol, you can get seizures. So it's sort of a specific thing to remember. Remember also with any child who's seizing that you need to check their blood sugar. Okay. The treatment for it, well, we said reversal. This is the number in Australia for poisons information, 131126. And if you ring poisons and say, my child has taken a tablet, a narcotic, they work on the concept that dangerous you need to go to hospital if you've taken the equivalent of codeine 5 milligrams per kilogram orally, because this is what will cause, may cause significant respiratory depression. In the case of methadone, 50 milligrams is, which say for 10 kilo is 5 milligrams per kilogram, is 500 milligrams. But at 50 milligrams per kilogram, that can kill for a 10 kilo kid. So if you've taken 50 milligrams of methadone, which is not uncommon, as a takeaway dose for patients, for parents, then if they get hold of that, that can certainly kill them. It's 10 times the dose that would be concerned for respiratory depression. Okay. Other bits of treatment, of course, controlling the airway. Bizarrely, charcoal's recommended within an hour. Look, from my point of view, I don't think this holds up. I don't think it's a particularly valid idea. You could do it if you've got control of the airway, but I don't think it has any evidence to improve outcome studies. And I think it will just cause havoc. Naloxone, interestingly, the naloxone, you need to go on a mean time of up to 51 hours of methadone. It's long acting. So you're going to have a long-term naloxone infusion. Okay. let's move on. So we've got 6 cases. This is case number 2. Thanks to Chris at Life in the Fast Lane for his tremendous work here. And I've basically stolen it from him. 3-year-old brought in by ambulance, decreased level of consciousness, protecting his airway. Okay, not giving too many hints there. Respiratory rates down. Pulse rate down. Blood pressure hanging in there. Meiosis bilaterally. So this could very easily be a narcotic overdose, couldn't it? It's not going to be, but it could easily be a narcotic overdose. And their P on the AVPU is only responding to painful stimuli. Okay. Weight of 20 kilos. The mum says that 3 sleeping tablets are missing from the handbag and that she herself had been sleeping for 1 to 4 hours. Well, I suppose it could be a benzodiazepine, couldn't it? It's a sleeping tablet being a narcotic. It's probably unlikely. So any idea what this is? I didn't immediately know when I was reading through initially, to tell you the truth. It is clonidine. Now, clonidine's used more widely or seen more widely than it was historically, mainly because it's to do with, narcotic withdrawal, hypertension, ADHD. So you'll see it kicking around when 15 years ago, very rarely did. If you've taken 3 tablets like this child probably has at 300 micrograms, remember the child's only 20 kilos, so that's 15 mics per kilo. And if you look at clonidine ingestion, 15 mics per kilo is getting towards potentially apnea coma like this child has. So it's particularly nasty. What is it? Well, it's an alpha-2 agonist, works on imidazoline receptors peripherally and centrally. Onset's pretty quick, and initially you get this peripheral, this hypertension and tachycardia from alpha-1 stimulus in overdose because it becomes not just an alpha-2 agonist, and then you get the hypotension and bradycardia that this child's got. It decreases the noradrenaline plasma concentration at higher doses, and that's when you see those changes this patient has. CNS repression, constricted pupils, hypothermia. So it looks like a narcotic ingestion, but does it respond to Narcan? It's surprising about half people do, but at really high doses, apparently. Now, I was looking on the internet about clonidine overdose, and there's a video, which I think is on the next slide, of a child that ended up dying. And this video was taken from the CCTV inside the hospital. And it shows really to me the degree of respiratory depression and CNS depression that you get with clonidine ingestion. I mean, this child, from my point of view, obviously needs to have some airway support at this stage. And you can see that even though the respiratory rate seems to be okay, it's the patient is really hypoventilating. So treatment, 13, 11, 26, charcoal, no. Whole bowel irrigation if they swallow a patch. Okay, this is
I'm going to kind of rub him on the chest. It's painful, and I just want to see how he responds to that. I'm going to rub
deeply
your chest.
Unconscious.
Sorry.
And hypoventilating.
I'm going to pinch his right and left side. I'm going to be pinching your thumbs here. Yeah, I know, I just got to do it. There we go.
Yeah, it's quite a disturbing video, really. But when I try and remember clonidine overdoses, I think of this video and remember that controlling the airway, controlling the breathing is probably the primary thing that's going to save these children rather than anything else spectacular that you're doing. Okay. Now to a same but different. This is...
Your eyes reflect your youth and love of life. Help keep that special sparkle with medically recognized Visine eye drops. In dropper or squeeze bottle. See Visine work in seconds.
So Visine,
Most toddlers, like
this child, sucked on Vicine, and this is a video about what happened to him.
Most toddlers, like Jeremiah Gurma, are full of life. Jeremiah loves to dance and sing and play. But weeks ago, this vibrant boy fell silent and almost died because he got his hands on this, Visine eye drops. According to his parents, Nia and Justice, he grabbed it off the bathroom counter shortly after Justice used it.
I don't know, just a gut feeling. I mean, I know it has chemicals in it, so I figured, hey, you know, let's just call to be safe.
A quick call to poison control changed everything.
The poison control told me to take him to the hospital immediately.
By the time she hung up the phone, little Jeremiah had begun to change.
5 minutes later is when he started kind of fading out on me. So I was trying to make him talk to me and say my name, and he's, you know, basically can barely say mommy.
She raced to Spring Valley Hospital, and by the time she walked through the doors of the ER, Jeremiah was unconscious, and doctors immediately tried to bring him back to life.
You know, there was like 5, 6 doctors around him, and she was on her knees praying. So, you know, and he wasn't responding.
When someone ingests Visine, it immediately begins to constrict your blood vessels. In an adult, it can cause nausea and vomiting. But in a child less than 50 pounds, it basically stops the blood from flowing through their veins. It can lead to a coma and eventually death. Yet you'd never know that looking at the bottle. The bottle just says to get medical attention or contact poison control if ingested. And there are no safety caps on Visine, so any small child can open a bottle with ease and suck on it just like a pacifier.
There should be skull and bones on this thing because it can kill.
Nia and Justice were told if they had gotten to the ER just 5 minutes later, their son would not have survived.
So that's a classic sounding clonidine overdose, which is what Visine is, clonidine in a bottle, really. If you've got the right dose, it acts like it. The next video is really more of an interest, someone trying to kill someone with Visine.
Why did Lana Clayton allegedly poison her husband?
It's the common over-the-counter medicine used to relieve red or irritated eyes. But this morning, investigators say they still have no clear motive as to why 52-year-old Lana Clayton allegedly used eye drops to kill her husband of 4 years.
Well, she did admit during interviews with our detectives that she committed the crimes.
Stephen Clayton was found dead in the foyer of this $800,000 South Carolina mansion he shared with his wife in July. Police say they never suspected foul play was involved until toxicology results from his autopsy revealed high levels of tetrahydrozoline, the chemical found in eye drops and nasal sprays in his bloodstream. If ingested orally, it can cause respiratory failure, seizures, and even comas.
During our search of the home, we found several bottles of the eye drops.
Police say Clayton admitted to poisoning her husband's water with the drops over the course of 3 days before his death. Neighbors say Clayton, an active member of her local church, held her husband's funeral in their very own backyard last month before investigators determined his cause of
death. Well, there you go. So Visine, not so safe. Remember, it's working on the imidazoline receptors. And look at low dose, it causes some vasoconstriction, which is why you use it on your eyes. But at high doses, you get the central effects. And essentially, it's clonidine in a bottle. Mild toxicity, you get some agitation, and then severe, you get all those signs like we saw with that young boy earlier. So don't get any ideas about going home with your Visine, and don't blame me. Okay, case 3. Another 2-year-old boy brought in by ambulance with a seizure, 20 minutes generalized. The ambos did what ambos do, checked the sugar, which was low, and then gave some glucagon intramuscularly. And the seizure stopped, but then started again, and they had a seizure coming to ED. And the child has been looked after by grandma, had been previously healthy and well. What do you think? The child had its sugar checked in ED and it was still low, so some dextrose was given. And the ingestion, as some of you may be considering, is a sulfonylurea. So it's glipizide. and this can go and cause prolonged hypoglycemia. Stimulates secretion of insulin, and therefore you get a hypoglycemia, prolonged hypoglycemia. And if you're young and you're little, you haven't got much glycogen to use up, and so you get prolonged hypoglycemia. And of course, the hypoglycemia changes are those that we recognize at lower doses: sweaty, drowsy, tremorish, and then going towards having seizures and rhythm disturbances. So treatment, as you'd probably think, is supportive and get on top of the sugar, which is reasonable. So a dextrose bolus within a continuous infusion. Interestingly, when you look at, this is from the United States, their dextrose infusions is quite enthusiastic. So for between 1 month and 2 years, you use 25% dextrose, and it's at 2 to 4 mils per kilo. So that's going to be, for a 20 kilo, that's up to 80 mils of 25% dextrose. And then if you're over 2 years, you do an adult dextrose 50%, and then at 1 to 2 mils per kilo, and then check and repeat again. They say recommend food and drink and charcoal. Look, food and drink, if it's very, very mild, to bring the sugar up. But charcoal, really, no. But do remember 13, 11, 26. So there's more glipizide around now. So I think that, remember that you need to aggressively chase the sugar, and always check the sugar on a child who comes in with seizures. Half-life can be quite prolonged. Glucagon can be used, but it only buys you time. There is one other thing you can use, that's somatostatin or octreotide, because it just suppresses insulin release, and while you're giving dextrose, it smooths out the response. So you don't swing as much with your sugar levels when you start some octreotide. People give it subcutaneously, 2 mics per kilo. I haven't done this, but it's a safe thing to do. Okay, we're halfway through. So case 4. I wonder if it's another 2-year-old. No, it's another 2-year-old. Found lethargic by grandmother who was babysitting. They're getting a bad rap, aren't they? Grey skin, not responsive, only can just feel the pulse, which is really bradycardic, hypotensive, respiratory rates. Okay, so it hasn't got that narcotic or even the clonidine angle of having that respiratory depression, but has severe cardiovascular changes. What could it be? I mean, it's quite a lot of things it could be. It could be a beta blocker, it could be a calcium channel blocker, it could be, what do you reckon, potassium, amiodarone, flecainide. There's a whole lot of things that would fall into this. So you need to get some help to see what grandmother's had and have a look at the child. Thanks to Ed from Life in the Fast Lane, this is the ECG. And if you look at it, it's extremely bradycardic, and you can see here that it's 3rd-degree heart block. There's a dissociation between the P waves and the QRS, and the escape from the QRS is a right bundle. So 3rd-degree heart block, bradycardic, escape right bundle. Grandma checks her medications and she goes, oh, there's a couple of tablets of my Isoptin SR, 180 milligrams missing. So your immediate response is, bugger. For a couple of things, it's a calcium channel blocker, which can be very hard to look after an overdose. And the other thing is it's slow release, so it's going to be around for quite a while. So what do we do? What do we expect, first of all, from a calcium channel blocker? Well, we can see some of it, the bradycardia, the hypotension, the low BP. They didn't have a really low BP at the moment, but that vasodilation can be quite marked, and you need to fill them up with fluids. Decreased cardiac contractility, heart rate, and conduction. Well, we've seen that already. And you may get hypoglycemia. Okay. And it's going to last well because slow release. So, I mean, it's easy to say treatment, ring poisons, 13, 11, 26, do ABC. But let's be more specific. ABCs, and do you use charcoal? Well, look, maybe if you've intubated the patient that you would. Whole bowel irrigation, Yeah, it's a slow release. So if you've intubated the patient, control of the airway, then you can consider using a nasogastric tube on a kangaroo pump and starting at say 200 mils per hour and then seeing how that goes. And of course, 30, 11, 26. But let's get those specifics. Do you give calcium? Yes. Now you can give calcium gluconate. The advantage of that is that you can give it peripherally a lot more than you calcium chloride. So calcium gluconate, 0.8 mils per kilo of the 10% solution, or in severe, they recommend using the calcium chloride. It's a lower dose. Again, it's a 10% solution. And if you've got a central line in, if you don't have a central line in, just use a large peripheral line. Atropine seldom works. What about pacing? Seldom works. Inotropes, the best inotrope to use probably is adrenaline. That also helps with the vasoconstriction because the arterial vasodilation, and people are kind of reasonably comfortable with the adrenaline. There's the inotrope and the chronotrope going on. What else can you do? High insulin euglycemic therapy, where you're giving 1 unit per kilo of insulin IV, obviously with glucose coming in the other arm, keeping a close look on it. There's not a lot of stuff which I could see on pediatrics, but it has been shown, and there was a group of 70 people that got it, and they got about a 75% success rate with it, but they were adults. So that certainly is on with the chance. Glucagon now is considered no role. In fact, it's not even considered in beta blocker overdoses. And verapamil is lipid soluble, so there is potentially an intralipid infusion that can be given, and that would certainly be on the cards. You have to get it done pretty early. And if you're in the right place or you can get access to it, then a patient like this may be reasonable for ECMO. Or can be religious and use holy water, which may not work. Okay, so interesting one, that isn't it? It's the calcium, and then you've got to use the high insulin euglycemic therapy, intralipid, maybe ECMO, probably no use for glucagon. Okay. Second last case. 15-month-old girl, less than 2 years for once. Prolonged generalized seizure. Has recently had a blocked nose and a cough, not COVID. No antibiotics. Mum's been putting topical decongestant rub on her chest for every hour for the last 4 hours. And that's thought to be the cause. So what is it? Yes, Vicks Vapor Rub. Be careful of this because of the camphor in it. So camphor at the moment is 4.8% of it. And it's got a bit of eucalyptus oil, cedar leaf, turpentine, which can cause a few problems cerebrally. The rest of it's petroleum jelly. And so you expect to have cerebellar and cerebral things like seizures, ataxia, and gastrointestinal vomiting, nausea. It's rapidly absorbed. So vomiting, agitation, seizures, hyperreflexia, decreased level of consciousness. This used to be a real problem because the Vapor Rub, Vicks Vapor Rub, had a much higher percentage of camphor in it before. Most of the treatment for it is, treatment with benzodiazepines for seizures, keeping an eye on the sugars, and supportive. In this case, they required 0.4 milligrams per kilogram intravenously of benzodiazepine and intubation, but went well. Interestingly, deaths have occurred with the equivalent of 20 mils of Vicks Vapor Rub, which isn't that much. It's 4.8% now, but it used to be in the United States up to 11% of Vicks Vapor Rub was camphor. Sorry, I got that wrong. It's 11% maximum at the moment. They used to have 20%, which was banned because of deaths in 1982. But you still got, 2.5 times the dose if you're in the States compared to Australia. There is a baby formula, a Vicks Baby Rub, that doesn't have camphor in it. It's got some aloe vera, some fragrance, and petroleum jelly. This is just an old ad for Vicks VapoRub.
I hear you came down with a nasty cold last night.
Nasty cold.
Yep.
You were all stuffed up, huh?
Hard to breathe.
What'd your mother do?
Rub some nice medicine on me. Vicks VapoRub.
Oh, mothers call it the love rub. Bet it helped.
Yep. Later I could breathe easier.
Sure, it's more than love. It's good, effective medicine. Vicks medicated vapors work on your stuffy nose for up to 8 hours. How'd you sleep? Vicks VapoRub. It's more than love. It's good, effective medicine.
Good, effective medicine with a bit of luck, less than 20% camphor. Okay, this is the last case we're going to be looking at. The last case, and this is actually not a 2-year-old child. This is a 49-year-old Cambodian lady who was using a liniment bottle because she had some abdominal pain. She was rubbing it on her abdomen, but then frustrated with lack of success, she decided to scull the rest of the bottle. Unfortunately, and this just had occurred about 4:30 in the afternoon, she went to a local doctor who then sent her to ED. She was seen by someone relatively junior initially, but then was reviewed relatively quickly afterwards when they found that she'd drunk this. Not too sure how much of it, somewhere between 15 mils and 50 mils of this analgesic rub. She's otherwise looked not too bad, but she's insulin dependent. And in the bottle that she had has the turpentine oil, which can cause some cerebral and cerebellar signs, but mainly 2/3 of it is oil of wintergreen, and that is the problem. So they think maybe it's 15 to 20 mils when they spoke to the family. She's drowsy with increased respiratory rate, a bit tachycardic, blood pressure's okay. They take a salicylate level off, do an ECG, some bloods, and ring poisons. And poisons on 13/11/26 say, you have a problem. Well, this ECG showing sinus tachycardia, not too much more around the place. Poisons say oil of wintergreen will be a problem. If they have had 15 mils of it, that's equivalent to 15 grams of aspirin. So that's 300 milligram, 30, 40, 45 tablets of aspirin. If she had 50 mils ingested, then she'd put 45 grams, almost at 130 tablets. And there's the problem. Deaths have been recognized with as low as 15 mils in adult and 4 mils in a child. So this really is a classic of dying from salicylate. You can survive with high doses. So it's a lot of salicylic acid tablets. So what do you expect to see? Well, it's rapid onset because it's absorbed so rapidly. You have direct initial stimulation of respiratory centers, so you have respiratory alkalosis. Seen more commonly in adults. Within children, they tend to present a little bit later with the metabolic acidosis, but respiratory alkalosis, then mixed respiratory alkalosis and metabolic acidosis. And the acidosis because it uncouples oxidative phosphorylation. I'm not going to go through all the biochemistry like this because you will forget it, as I often do. So I looked at this and I thought, look, let's make it simpler. Let's make it a bit simpler. It's absorbed quickly. It saturates the protein binding. So you end up with saturatable kinetics. So the free amount in your blood, which is the bit you see actively on your cells, goes like this. And then when you've bound all your protein sites, suddenly the free amount increases rapidly. It's got a low volume of distribution. And it has a pKa, which is the pH where the ionized and unionized forms are equal, is at 3.3, which is important for some of the treatment. I'm just going to look at the treatment, mention the treatment first, and go a little bit back to what's happening to you in 2 seconds. You'll see you need to alkalinize your urine. The reason that you alkalinize the urine is that with that pKa of 3.3, if you alkalinize the urine, much more of it will be in the ionized form. Now, the ionized form of this acid can't go across lipid membranes. Okay, the unionized form can, but the ionized form, so it gets shoved into ionized, It's in the tubules. It can't get out, so you piss it out. And that's an effective way of eliminating some of this ingested salicylates. You obviously must make sure that they are not dry because they hyperventilate. They tend to be hypovolemic, so you need to treat them with fluids anyway to flush through the kidneys. But once you've started that, alkalinization with sodium bicarbonate can really enhance the elimination. Okay, now they did some blood tests. It didn't show too much, to tell you the truth. Sugar was up a bit. Salicylate level initially was high, and the rest of the numbers are okay. And they had a mixed respiratory alkalosis plus some metabolic acidosis. The treatment, they were given some charcoal, okay, IV, alkalinized urine, IDC, went to ICU. The thing about salicylates is the way it works is it does electron transfer across, and if you have your salicylates, it will make your cells act inefficiently. You'll need much more carbohydrates, protein being delivered to your cells, and then the breakdown products become inefficient because you can't create your ATP as efficiently as you normally can. So you develop more CO2, you develop more heat, and you have to use up more substrates. So you get hyperglycemia, then hypoglycemia later. You get hypothermic, you get acidosis, you get ketone bodies formed. Kids tend to present with metabolic acidosis, I mentioned. Seizures are common. If they are hyperventilating and you intubate them, continue hyperventilating, or you'll shift the salicylates in their body. Non-cardiogenic pulmonary edema is well recognized, but GIT bleeds are uncommon. Okay. So what do we look at for these 6 patients? Well, the first one, opioids, especially methadone. Clonidine, remember that video that we looked at before, and Vicine, which is basically clonidine in a bottle. The persistent hypoglycemia that needs to be treated with sulfonylureas. The Vicks VapoRub camphor that can occur, and the salicylate and extraordinarily high salicylate levels that you can get with oil of wintergreen. We haven't looked at some of these other things. We also looked at calcium channel blocker with isopten. So these other things we haven't had a chance to, and there are a whole list of ones we could do, but I think that'll probably do for today. As Paracelsus said, all drugs are poisons. The benefit depends on their dosage. So we might just leave it at that, and look forward to seeing you next time. Let's stop sharing and we'll end the meeting. If you have any questions or concerns, then contact me on alan@health.nsw.gov.au. Look forward to hearing from you. Thanks for today. Cheers.